Minister. We'll now go to the phone for questions. One question, one follow-up. Operator.
Thank you. Merci. Star 1 for questions. Étoile 1 pour des questions. Première question, l'inaudible, la presse canadienne.
Canadian Press. Hello, Mr. Trudeau. On Monday, normal work of the House of Commons should resume. I know that's not what you want. The Conservatives do. And you seem to have lost your last ally, which was the NDP. There's the Bloc. They're asking certain specific things of you. Are you going to give them what they want? Or are you going to go back to regular House of Commons sittings? Are you going to bring these changes to the CSB, the CERB? One moment, Lena. What we want is to continue defending our democratic institutions, and we want our parliament to work. It's extremely important, not just despite the crisis, but because of the crisis. It's important to have a working parliament. For many weeks now, we've been meeting three times a week, twice virtually, once in person, to allow MPs from throughout the country to ask questions and to bring their contributions. And also, since the beginning of this crisis, these contributions come from different parties, and these have helped us to provide help for millions and millions of Canadians. We absolutely need for this work to be done. Work has to continue at the House of Commons. Right now, discussions are being held between the different parties as to what is the best way to do this, given the situation around COVID-19. And these conversations are ongoing. But I would like to highlight that all the parties, including the Liberal Party, want us to have the opportunity to make our Parliament work in the right way. Yes. Let me say this in English.
Continues to function. We've been meeting 3 times a week, twice virtually, once in person, to ensure that MPs from right across the country continue to be able to share the concerns of their constituents, ask questions of the government and its programs, and also highlight solutions that will help Canadians as we move forward. And from the beginning, we've had tremendous input from all parties that has helped us make sure we're getting it right to help millions of Canadians right across the country in this moment of crisis. We want to make sure that we are functioning as an effective parliament during this time, not in spite of the crisis, but because of the crisis. And that's why we're working right now with other parties in the House to try and figure out what the best way for us to move forward, to continue our democratic processes, to continue to have a strong functioning parliament and democracy, while at the same time ensuring that we're keeping everyone safe.
Suivi, Lena? Lena, suivi?
Follow-up question? Lena, we didn't hear the first part of your question. Yes. The Bloc is asking for 2 specific things. Could you come back to these 2 demands? They want changes to CERB. They want more assistance for small businesses. Are you prepared to give in to the Bloc Québécois' demands? We continue to demonstrate flexibility with regards to CERB. We know that we need to help more people, and we continue to do this by working jointly with other parties and Canadians. With regards to fixed costs, the largest fixed cost is rent. And the announcement of today of the Canada Emergency Rent, Commercial Rent Assistance Program will help. So we are going to continue our discussions with all parties to have a working parliament.
Hi. Good morning, Mr. Prime Minister. Sorry, having a problem with my phone here. So with provinces and economies opening up, First Nations communities are remaining closed. Now, do you support these extra measures, even though they create tensions with nearby jurisdictions?
From the very beginning, our focus has been on keeping Canadians safe, with particular emphasis on people who are more vulnerable. And we've seen that because of challenges around health delivery, existing challenges and inequalities, Indigenous communities across the country are at a greater vulnerability to COVID-19 than others. That's why we put in place measures early on to help these communities protect themselves and be supported in this pandemic time. We know that as the economies start to reopen, as activity picks up across the country, we're going to have to make, and local jurisdictions will have to make very careful decisions about how and where to reopen. And we need to make sure that every step of the way, people are working with all local stakeholders, including and specifically Indigenous communities and leadership, to ensure that we're not bringing in greater risks. As much as we want the economy to reopen and things to get back to normal, we need to put the safety and security of all Canadians at the forefront of everything we do.
And a follow-up, Jamie?
Thank you. And as a follow-up, just on a different note, this pertains more to federal than provincial prisons. But in terms of early release programs, getting inmates with a history of respiratory illnesses out of jail, now with the relaxing of restrictions, is that not a priority anymore? And I was wondering, will Minister Blair be at the committee update today, or when will he be there?
We've continued to look very closely at how we can ensure that federal institutions like our correctional facilities are kept safe. We're looking at various measures and have brought in a number of measures to keep both inmates and staff at those facilities safe. We continue to adjust as time goes on, and as things become more necessary or less necessary, we will stay active on it on a daily basis.
Thank you. Next question, operator.
Thank you. Merci. Next question, Christy Kirkup, the Globe and Mail. Line open.
Good morning, Prime Minister. You've addressed the issue of increased economic activity today. Spain has made the mandatory wearing of masks, except for children. Is the mandatory wearing of masks being considered by Canada's Committee of Chief Public Health Officers from across the country?
I know public health authorities are continually looking at the research and looking at the best way for Canadians to protect themselves. I believe they will have further recommendations on masks in the coming hours. The reality is the best thing for people to do is to remain socially distanced, to keep 2 meters apart, to stay at home wherever possible, and to wash your hands regularly and frequently. But in situations where you cannot physically distance to 2 meters, people are encouraged to wear masks, and I will allow public health authorities to make that announcement a little later today. Okay. Je pense que nous savons tous que la meilleure façon.
We all know that the best way to protect ourselves is to keep 2 meters of distance and also to stay at home as much as possible. In circumstances where we can't do that and we're unable to keep 2 meters away from people, it could be helpful to wear a mask. The Public Health Agency of Canada will make an announcement in the hours to come.
In your office, for example, can you just paint a picture for Canadians about your personal approach to mask wearing? When are you wearing a mask? How are you wearing a mask?
Obviously, everyone's situation will be different, and we always need to pay attention to public health authorities. When it is possible for me to keep 2 meters distance from people, that is what I prefer to do. In situations where I'm either walking through the halls of Parliament or going to my office and coming in proximity to people, I've chosen to start wearing a mask. I will be wearing a mask as I go into Parliament this afternoon for our in-person in-person sitting. Once I am at my desk in Parliament and 2 meters separate from everyone else, I will take off my mask so I can engage in parliamentary discourse. But as soon as I leave my seat and walk past people and walk through potentially busier hallways, I will be wearing a mask. That's my personal choice. That is aligned, I think, with what public health is recommending. I think we all need to adjust to what works in our circumstances and keep safety at the forefront of what we're doing. I think that everyone will make individual decisions with regards to their behavior and will follow the recommendations made by public health. For myself personally, when I walk through the buildings of Parliament, and I'm going this afternoon for a parliamentary session, when I walk through the hallway or when I'm getting to my seat in the House, I will wear a mask. Once I will be at my seat, I will be 2 meters away from my colleagues. I can take the mask off to participate in question period. Then when I leave, I'll put it back on. This is a choice that I make. It is possible that I will be within 2 meters of someone, so I will wear a mask at that time. I encourage Canadians to think about how they can protect themselves and protect others by following the recommendations made by public health.
Thank you. Merci pour cette question. Marie Vastel, Le Devoir, à vous.
Hello, Mr. Trudeau. I'd like to come back on the work of Parliament. Now, for 6 weeks, over 6 weeks, 6 weeks have been missed. The Bloc Québécois is talking about sitting through August to catch up this time. So are you thinking about this? Are you thinking about having parliamentary sessions during the summer? Do you think that we need to catch up on this time that has been lost? I think that this is a thought process that we're having, and we will have discussions with the other parties. We have an election platform that we were elected on, and we would like to deliver. We recognize that COVID-19 has profoundly changed the way that the country has to live. And 2020 has been a very different year. Adjustments have to be made with regards to the Parliament, whether it be during the following month or the months to come. We are having discussions with other parties. It's important for us to continue to sit, and we have been sitting 3 times a week, virtually and in person, and this has been very important to continue to allow MPs to do their work. I'll try to get more detail. I understand that discussions are underway, but you personally, do you think that this time should be caught up during the summer, or do you think you personally that this is a good solution? What do you see as a scenario? Well, this really depends on the discussions with the other parties, how we're able to go forward with important pieces of legislation in the months to come, what types of legislation should be brought before the House of Commons in the months to come. I'd like to give you more detail, but we are in the middle of a situation where things change from week to week, and we are adjusting as best we can. It is possible that we'll have to sit more frequently, but we will look at this with other MPs to see what it is that we need, and also to see what we can do to remain safe. Louis Blouin, Radio-Canada. Now, for the House of Commons activities, I'd like to come back to this. There's a request that seems to come up a lot, and it's the need for an economic update between now and the summer. The Bloc Québécois wants one in June. Are you open to discussing this? And on this idea of the hybrid House of Commons, to have people sitting in person and virtually, what do you think of this? I think that the hybrid parliament is an interesting idea. We've seen this in the UK, and we said that this could be explored and people might be prepared to go ahead with this. It might be a good way to allow Parliament to sit in person, but also to make sure that people who are in in provinces far away can also sit and be represented at the House of Commons. So discussions are being held. Now, with regards to an economic update, we've always been transparent with regards to our investments, what we're doing. Of course, things are changing week by week. We will want to share with Canadians how we see the weeks to come. But, of course, each and every day we work to try to have the clearest.
I think there's a lot of interest in a hybrid parliament model where some people will be there in person, where others will call in via video conferencing screens. I think there are ways of making it work and ensuring that MPs from every corner of the country get to participate and make sure their citizens are reflected in the debates that go on in Parliament, and not just those who live near the National Capital Region. Obviously, these are discussions that continue, but there are models that are effective out there that we should look at adapting for Canadian use. And in regards to where our economy is going, our government has been open and transparent about all the various measures we're putting forward. It is still very difficult to predict where our economy might be 6 months from now or even 3 months from now, but we will continue to work on sharing with Canadians a picture of what the future could look like.
Sur Twitter, le président Trump lance l'idée d'un
On Twitter, President Trump is talking about an in-person G7 meeting. Would you go? Well, we have to highlight the importance of the G7 and the importance of having in-person meetings to fight against the crisis, and also to speak about how we're going to restore the global economy. It's very important to have a meeting. We've already had a virtual meeting a few weeks ago. It's important to have another meeting, one way or another, in June. As for a proposal to have an in-person meeting, we'll see what the Americans will suggest, and we'll see what will be the conditions or the measures that will have to be respected. It's interesting as a proposal, but we need a lot more detail before making a decision.
To have leader-level summits. We had a G7 leaders virtual meeting a few weeks ago where we talked about this important situation we're in, and we're going to need to keep talking about not just how we get through this COVID-19 pandemic, but how we restore the global economy to its rightful activities. So yes, we need to keep meeting as leaders. Whether that's virtual, in person, we'll certainly take a look at what the U.S. is proposing as host of the G7 to see what kind of measures will be in place to keep people safe, what kind of recommendations the experts are giving in terms of how that might function. There are lots of discussions to come, but we look forward to having those discussions with the American hosts.
Hi, Prime Minister. Tom Parry, CBC. You're asking landlords to take part in this program that you're bringing in. We've heard reports, though, of some landlords who aren't taking part, refusing to take part. Doug Ford was very forceful on this yesterday. I'm wondering, are you having conversations with the premiers about putting more pressure on landlords to try to get them to take part in this program?
I think we all understand that this is a crisis that is hitting really hard on businesses right across the country. And we know that if our economy is to come back, we need a large number of those businesses to hold on and to make it through this pandemic. That's why we are providing commercial rent assistance to landlords and tenants, and we really hope that they will take up on it. We know that if many businesses aren't able to make ends meet and do go under at this point, it'll be a lot slower to pick up the economy, and that'll be bad for Canadians, but it'll also be bad for landlords. It'll also be bad for building owners who will see a slower regaining of economic activity, and indeed with many people discovering that we can work from home, that they, to a much greater greater degree, there may be a lot of vacancies in commercial buildings over the coming months and years. Who knows exactly what the post-pandemic world will look like exactly? And that's why making sure we're supporting the businesses we have now to be able to stay in their spaces as we grow, as we slowly restore our economy, is going to be important, and we certainly expect landlords to be part of this solution.
We know that it's extremely important to have the economy rebound. If we have too many small businesses and too many people that lose their business because they don't have the necessary support during this pandemic, the economic recovery will be slower, and this will hurt the economy in general, but it will also hurt the landlords and the business owners. So, we hope that the owners will avail themselves of these measures to help their tenants to weather the storm so that we're able to come back as an economy. During this type of crisis, we have to be there for each other, and this is what I'm expecting from owners.
More than 2,000 home visits for people coming back into Canada, making sure that they're complying with the self-isolation rules. You were talking yesterday about bringing in more measures when non-essential travel is allowed. Other countries have brought in monitoring devices for people coming into the country. Is that something you'd look at, or do you want to look at other options first? Where do you stand on that?
I think we know that a key part of reopening and keeping our economy going and controlling future spreads of COVID-19 will involve being very, very careful that we're not importing new cases, even as our economies open up, even as border restrictions are potentially loosened down the road. We need to make sure that we have the measures in place to be able to ensure that new cases aren't arriving and spreading through the general population. We're in discussion with the provinces and territories to ensure that we do have the capacities to do that as we look towards economic reopening. Those conversations are ongoing.
Prime Minister Janet Silver, Global News. You spoke just a moment ago about rent relief for landlords. Why not give that relief directly to the tenants? Why not just bypass the landlords if they're reluctant to start using it?
We know that the solution involves bringing different communities and groups together. The landlords need to be a part of the solution on this. We need them to understand that they do have a deep vested interest in keeping their renters in those spaces, that if more businesses go under because of COVID-19, we're all going to be worse off. And that's why this approach, in concert with the provinces, is going to be the right approach to do it. And we implore and expect landlords and building owners to understand that we all are in this together and we need to be there for each other. And this program is there to help them and to help small businesses.
And as provinces reopen and parents are expected to go back to work, childcare is an issue. I know that is a provincial matter, but I'm just wondering what discussions you may be having with provinces in terms of childcare to help out those parents, and are you concerned about the lack of childcare in this country and what impact that may have in terms of reopening the economy?
As a party, we've long been concerned about the lack of childcare spaces across this country. We know it's a challenge in the best of times for families to find that balance between care for their kids and the jobs they need to support their families. That's why when we formed government in 2015, we moved forward with historic investments in childcare agreements with the provinces to increase the accessibility of childcare. In our last platform, getting re-elected, we made more commitments on childcare of working with the provinces to invest in programs that will help more parents, more families, and grow our economies and our communities. We need to continue to do that, particularly right now, and we will be there to work with the provinces as we reopen and respond to childcare needs.
Hi, Prime Minister. Molly Thomas, CTV National News. While your government has flexed its fiscal firepower, as you call it, no government has unlimited money. So big businesses can now apply to this LEAF program for loans, and your government will ultimately choose who gets that money. So how comfortable are you in this new economy choosing the winners and the losers?
I think it's important to highlight that with the new LEAF program, the government is there as a lender of last resort. Large businesses, unlike the small businesses that we've been very generous and direct to with the Canada Emergency Business Account, large businesses have much greater access to credit on the international credit markets through the big banks, and that's why we are encouraging them to make available the credit facilities that they have right now. If they're in a situation where they cannot access that credit, they can turn to the government for funds through the LEAF program, but they are loans that come with conditions around governance, around paying proper share of taxes, around a plan for climate change. These are the kinds of things that we expect as Canadians when our taxpayer dollars go towards supporting businesses. So we are there as a program, but there are many conversations and discussions that are going to happen within companies as they look at the best way to weather this storm.
Prime Minister, switching gears a bit, the United Nations said today that Canada has an obligation to secure the urgent release and repatriation of a 5-year-old orphan girl who's in northeastern Syria, especially now with COVID posing an added threat. She has family here in Canada. What is your government going to do to get Amira out of that overcrowded refugee camp? We have been working on this file for many months now. We know that it is an extremely difficult situation for the family. We're making sure that we're going through the proper processes, but we also understand the importance of being that country that is consistently there to support people in difficulty around the world. We're trying to do our part, even in difficult situations, and I want to thank the extraordinary public servants who are working even through this pandemic to help. Merci beaucoup tout le monde.
That is Prime Minister Justin Trudeau speaking about a lot of different things, including the money that big businesses are going to get. That application period starts today. And we also heard about something else that might affect your day-to-day. The Prime Minister said that we are going to get new advice, new information, potentially new guidance when it comes to wearing masks. He himself said he's going to wear one when he goes into Parliament and especially around crowded hallways. Let's bring in Abigail Beeman on that. Now, Abigail, this has been a debate because some experts have said there is no evidence to say that masks work. And then other countries where we've seen mask wearing have had better results when it comes to COVID-19 cases. So what could we potentially be hearing and from whom?
Well, a huge debate. And the Prime Minister said that, first of all, that public health officials were going to be giving an update and announcing some new recommendations for wearing masks. He said that he didn't want to step on their toes or give away what they were saying. But then from his messaging, it sounds like he said that what he supports is wearing a mask if you can't keep 2 meters away from other people. Now, we'll have to wait and see what the ministers say about that. And that daily press conference is scheduled to start at noon. We'll see what happens there. But he said that about wearing a mask if you can't keep 2 meters away from someone. And then he said, I believe that that's in line with the advice from public health officials. So we will see if public health officials take a stronger line on advice for Canadians to wear masks. The Prime Minister then said that he himself will wear a mask when he shows up on Parliament Hill today, when he's passing through hallways where he may not be able to keep a 2 meter distance from other people, and that once he is seated in the House of Commons, he will take off his mask. So that is a departure. That's not something we have seen before in that setting. We have seen the Prime Minister wear a mask before in public. A notable case was for the repatriation ceremony after the chopper crash a couple of weeks ago, and we did see him wearing a mask, and it did, look quite different. But I think to see that in the halls of Parliament and arriving on Parliament will be a different picture as well, and we'll see what public health has to say about that too.
Yeah, and just so everyone is clear, so we're all on the same page, experts say that the mask doesn't protect you from getting anything. It protects other people from you in case you are sick. So we'll see what the guidance is. Really curious about that as it does impact all of us day to day. Now, Abigail, some strong words from the Prime Minister when it comes to landlords, and this is specifically about the rent relief program. What is he telling landlords to do, and how does that impact the economy going forward?
He's telling landlords here's the program, take part in it. But I think many people were expecting some details about, how is the government going to incentivize this for landlords? How are they going to encourage landlords to take part in it? We were told that some new details about the program would be coming, that he would be talking about the program. Really, the only new detail, as far as I could see, is that the portal will open May 25th for landlords to be able to apply, and they can get some more information about how that is going to work in terms of rent relief. But there are a lot of unanswered questions about why, and we've seen and heard pushback from landlords that haven't wanted to take up on this program and to see it happen. So it will be interesting to see going forward, especially with yet another. I remember talking about the April 1st rent being due, and then May 1st, and now here we are 2/3 of the way through May, and June will be a big problem for many businesses that are hanging on right now. But the Prime Minister was asked directly, how are you going to incentivize this? What are you going to do? He was asked by Global News, why isn't this something that, tenants can apply for? Why is the onus on the landlords to apply for this? But no direct answers there.
Let me ask you, Abigail, I just want to pick up on what you said. So why don't some landlords want to apply for this? What problem do they have with it?
Hearing a variety of things that it's an onerous task, that they're the ones who have to set out and make this application and do this, that there's no benefit for themselves. The way the program breaks down, it's forgivable 50% for the landlord. Tenants are expected to pay 25%, but then they lose that other 25% of the rent. So there are landlords who don't want to lose out on this, who expect tenants to just pay them. And the government has said, look, we've put all these programs on the table to help, and we expect landlords to do their part. The Prime Minister also today speaking of the possibility of high vacancy rates going forward, saying nobody, of course, knows what the outcome of this pandemic is going to be long term. So we'll see if this changes things, if there's an uptick in it. But it is a wait and see point, and many businesses are in a tough spot who can't afford to pay June's rent at this point.
Okay, Abigail, thank you for that. I'm going to bring in Reggie Cecchini from our capital to the U.S. Capitol. South of the border, all 50 states are reopening ahead of the Memorial Day weekend. And Reggie, that comes as the death toll in the country approaches now 100,000. So every state has eased restrictions on some level, but the rules now vary state to state. Talk us through it.
Yeah, Farah, the rules do vary state to state. Look, we're just beyond the month point from when the Centers for Disease Control, in conjunction with the White House, had put out some gated criteria that states had to follow in order to get through a phased reopening. And very few of the states actually met any of the criteria that were listed in that three-part plan that was unveiled. And here we are now kind of in a similar situation. It was patchwork when these economies started to close, and it is now piecemeal as these economies start to reopen. Some states are doing it in a much more measured approach, like in New York State and California, Washington State, each of them kind of taking a very slow step to try and get back to some sense of normalcy. In New York State, upstate New York, western New York, they're allowing for very few businesses to reopen. New York City, though, is going to remain closed simply because it remains such an epicenter. But it's a stark difference when you go to different states like Indiana. It's a Republican state. They're not using some of the criteria that were listed from the CDC. And then if you break it down further, in Indianapolis, they are using that CDC guidelines. So it's mixed messaging causing the confusion from state to state. Texas saw its highest infection rate over the weekend with 2,700 cases. This as the state goes full-fledged on trying to get things reopened. And the state's attorney general is now kind of chastising these Democratic-held big cities for not following what the state is doing. It's really causing a bit of a problem. It's also causing problems because we're hearing reports that places like Georgia and Florida might be fudging the numbers that they're putting on their state websites, and that is causing problems when it comes to transparency, as people don't actually know what the case numbers are in the states that are actually trying to fully reopen.
I'm looking at the video that we're showing while you're speaking, and it's such a different picture here. I mean, beaches that are full. And one of the reasons behind the reopening, according to the president, is the economy, obviously restarting the economy. Everyone's trying to find that balance around the world. But some are saying now America's unemployment rate could reach 25%, Reggie?
Yeah, the Federal Reserve Chair was speaking over the weekend on 60 Minutes and said that there is a real possibility that given the fact that we're at 15% unemployment right now, we are going to get further numbers later on this week and in the weeks to come that show just exactly what the employment situation has been over the last month or so. And there is a fear that that unemployment rate could tick up to 25% and possibly not get down to the 8 or 9% range until the end of next year. And this really has sparked a big conversation as to what needs to be done to bring the U.S. economy back to possibly not where it was at the beginning of this pandemic, but somewhere better than where it is right now. There are two different versions on how to go forth with that. The Treasury Secretary, Stephen Mnuchin, was testifying on Capitol Hill yesterday, and he is echoing how the president is talking that the only way to get everything back to where it should be is businesses need to reopen, to let the money kind of flow back into those local coffers that can then be spread around. But the Federal Reserve Chair is calling on Congress to do more spending by saying, look, these stimulus packages that keep being passed, they're doing what they need to do. They're giving people money. They're allowing that money to be spent. And therefore, that's generating and creating revenues for these local economies. But the president has already said the recent bill that was passed in the House a couple of days ago, another multi-trillion-dollar package, is essentially dead on arrival when it heads to the Senate. And if it does pass the Senate, he says that he will veto it because he says Democrats are going too far. They're trying to put too many goodies in their bag in this attempt to stimulate the economy. So when you're seeing these jobless numbers at 25% unemployment rate as a potential, and you have two different versions coming on how to fix that economy, it, along with this kind of mixed messaging on how to reopen, is really what's causing a lot of the confusion.
Regina, the light at the end of the tunnel through all of this is a vaccine. I mean, who knows if we're going to get one and how far we are from actually getting one. But the other part is contact tracing. Now, that's clearly very important when it comes to the caseload and seeing who has COVID-19. Regardless of where you live, what does contact tracing look like in the United States right now?
Nearly non-existent. Remember, like we were talking about earlier, this gated criteria that came out from the CDC, contact tracing was an integral part of that plan to try and get your economy back to where it once was. But it simply isn't happening for a number of different reasons, up to and including the fact that there simply isn't enough funding coming from the federal government to the states to be able to carry out this contact tracing, to be able to say, this is where the virus is, this is where it needs to be isolated, and this is how we can stem that. And state governments are saying they don't have the equipment, nor do they have the resources or the personnel to carry out contact tracing. Experts have said kind of at a best case scenario, you need roughly 30 people doing contact tracing per 100,000 members of the population. And right now there are only 7 states plus the District of Columbia that actually have the staffing in place to carry this kind of contact trace testing out. And this kind of goes part and parcel with that growing problem across the U.S. where there simply aren't enough resources to carry testing out from coast to coast. So it's hard enough right now to tell who may be carrying the disease. It's even harder now to say who's potentially been infected by somebody that wasn't tested properly that's carrying the disease. And it all kind of intertwines with that fact that states are starting to reopen. It's hard to tell who's been sickened and who is passing this virus around. And with more people kind of coming into close contact with each other across these states that are just going gung-ho on trying to reopen, without that contact tracing in place, it really is going to cause problems. And this is really what health experts have been fearing now for weeks.
Certainly. Okay, Reggie Cecchini in Washington, thanks for your coverage and for joining us today. Now, as provinces slowly reopen in Canada, the big discussion is about schools because, of course, we know childcare is a big part of opening the economy. Our Janet Silver, our producer, asked about Trudeau about that. He said he's going to be working with provinces. No specifics were offered, but we do know in Ontario, we know that schools are canceled for the rest of the school year. I'm going to get you, Abigail, on that. And Raquel, I'd love to know what's happening in Quebec and how it's been going. But first, let's start with you, Abigail. Why did Premier Ford say that he doesn't want to even try to open schools going forward?
Well, in a nutshell, the Premier said yesterday that it just wasn't worth the risk to him, that, there's just a few weeks of schools left. So Ontario had the closure in place until May 31st, and then everybody was waiting for an announcement to see if students would head back to school for June. And the Premier came out yesterday and said, nope, nobody will be going back to school for June. Let's just hit reset and figure out a way to go back to school in September. He also announced that overnight summer camps in Ontario would be cancelled. A lot of people waiting to see if that could still go forward. A lot of disappointment there. But he did say, if there was a silver lining, that day camps, assuming that the trends continue as they are, day camps will be permitted to continue in July and August. But to tag on to what you're saying there, this raises a big question. If more and more people in Ontario and other provinces too, but looking at Ontario's example, if more and more people are going back to work, the Prime Minister is obviously continuously encouraging people to rehire their employees, more and more places are opening. What happens to parents who don't have school or childcare for their children? And that's why Janet Silver asked that question today of the Prime Minister. It's been asked for a while. The NDP in particular have been really pushing for childcare, for paid childcare for parents, but it's becoming more of a concern now with no school or school not being back, and parents who have been at home with their kids trying to figure out a new solution when they're recalled back to the office as well, and no clear solution at this point.
I can tell you from firsthand experience, it's very daunting to have no end in sight on that front. And you mentioned Ontario summer camps. The City of Toronto has already canceled its summer camps for the summer day camps, that is. So we'll see what happens in the future. Thanks for that, Abigail. Let's bring in Raquel Fletcher, because Raquel, in Quebec, officials called going back to school a risky bet. How is that risky bet going now, a couple weeks in?
Hi, Farah. Yeah, well, Quebec obviously taking a bit of a different strategy than the province of Ontario. It's been a couple weeks now that students outside of the Greater Montreal region have been able to go back to school. That is elementary kids, and it's important to remember also that it's not mandatory. So we're not nearly at full capacity. What we do know is that strict social distancing measures have been in place in those schools. For instance, you know, the desks have been set 2 meters apart, only 15 kids maximum per classroom. There are bells that ring every so often to remind students to wash their hands. But it is interesting, and I want to go back to what Prime Minister Justin Trudeau said about childcare being so closely linked to reopening the economy, because this afternoon the government of Quebec is going to continue with another announcement for its reopening strategy. Hair salons and nail salons, things like that are next. And of course, what does that mean for parents now who are slowly going back to work but maybe don't have childcare? And that has been brought up in a number of press conferences. And what the Premier has said is that he is asking for parents to be patient, that they are, you know, they have a plan, that they're gradually reopening things. So for instance, in the Greater Montreal region, daycares will open as of June 1st. Of course, there will still be limited spaces, so not everyone will get a spot. That means that some parents, you know, who are working from home, well, they might have to continue working from home longer than they might want to, for instance, because their child doesn't have a spot. So the Premier is saying, you know, this is coming, but it's a collaborative effort, and he's really asking for the patience of parents. We're going to get there. We're opening slowly, but how far can we open? It's all sort of up in the air, but at least there are some things opening. You know, Abigail mentioned summer camps, and the Premier has said, well, you know, we're going to look at that because that might be a solution for parents going back to work this summer, and maybe their kids are older than you know, they're school age, so the daycare's opening doesn't help them, but summer camps can be a solution. So that's all sort of in the works right now. Of course, very inequitable when you think about it, because, you know, outside of Montreal, some elementary school kids are going back. Within the Greater Montreal region, they're not allowed to go back. So who is getting access to education? The other issue, Farah, is that teachers also may have their own kids at home. So when it comes to online learning, that has been a big challenge here in Quebec, because, you know, high school teachers might be having to take care of their own kids at home and then are expected to give online lessons to their students. And it's just not working. This morning, one of the opposition members called the whole strategy a mess. Now, the minister says it's not a mess, but again, we have to be patient. That's the key message from the government is patience.
Yeah, certainly. Now, you mentioned hair salons and other openings potentially happening in Quebec. We know in British Columbia, hair salons opened yesterday, some of them, and they look very different for anyone wondering, with plexiglass and fewer seats. But let me ask you, does this mean these openings will be happening in Montreal, or is this a two-phase solution, so outside of Montreal and then eventually in Montreal?
Yes, Farah, that is basically the reopening strategy of the Quebec government is in the regions, which means, the cities outside of Montreal as well will reopen first, and then later on we'll have a date for the Greater Montreal region, which means the city of Montreal as well as the surrounding areas. And you mentioned it looking different, and Abigail also speaking about masks, and Prime Minister Justin Trudeau wearing a mask in Parliament. And of course, as these salons reopen, masks are going to definitely be a big part of that. They're probably going to be mandatory. Of course, we've seen Premier François Legault for the last week and a half say, he is strongly recommending wearing a mask, not just in Montreal, though, in the province entirely. Anytime you're in public transport or anytime you're in a store where you can't keep that 2 meters distance, wear a mask. So that is definitely a big change.
Certainly. All right. Good. Thank you for letting us know about that. That's Raquel Fletcher in Quebec City. I want to go back to Abigail Beeman because we know that there is an in-person sitting of the House, as there has been every Wednesday. But the opposition parties, well, specifically the Conservatives, asking for more in-person sittings. And I know that there's a lot of talk, Abigail, about the hybrid model that exists in other places, like in the UK, where they have a handful of parliamentarians who are there, and then they have about 100 that join via the computer, via some sort of app. So where do negotiations stand now in terms of what we're going to see the House of Commons looking like in the future, in the next few weeks?
Well, things are pretty interesting for those people who watch this stuff very closely. To get into the technicalities, the meeting of the House of Commons that you'll see today in person and those virtual sessions that you have been seeing are technically not sittings of the House of Commons, as we refer to them. What they actually are committee meetings of the special COVID committee that was set up. And the reason this becomes important to talk about is that the deal that was struck in order to have these meetings, and there's a lot of technicalities that we don't need to get into, but the deal that was struck will expire as of this Monday, when regular House of Commons is scheduled to resume. That's on the sitting calendar that as of the 25th, regular House of Commons will come back into place. Now, nobody wants 338 humans in one room, plus all of the staff members alongside them. So there needs to be an extension or a new deal to work out to set up a new system. The Prime Minister said, in terms of that question of a hybrid model that, as you say, is being used in the UK, that it's something that's under discussion, and that it has worked well in other countries, and that they are talking about adapting it to Canada. But where this becomes trickier in terms of negotiations is, of course, let's remember the Liberals are a minority government. You mentioned the Conservatives' position, that the Conservatives have been clear from the start that they want more in-person sessions, linking that to more accountability. And again, they're also not calling for 338 MPs to come back. They're happy to respect social distancing, but they want more in-person sessions. So where this becomes interesting is what we heard from the Bloc Québécois yesterday. Now, remember, they are the third party in Parliament, and the Bloc leader came out yesterday and said, look, if the Liberals don't support this list of demands that we have, well, then we're also going to call for more in-person sessions. So that was an interesting wrinkle, and you can bet some of the conversations this afternoon, the debate in the House of Commons, will be around that and some of the things that the Bloc are asking for. One of those examples is an economic update within the next month. They're also asking for summer sitting sessions in some form or another. So we will see. The Prime Minister was asked a couple of times about that today. He wouldn't commit to what he would commit to from the Bloc's list of questions, but this all has to be sorted out before Monday.
And the NDP also has a position. They want to see that sick leave, so that could be a negotiation tactic with them. There's, I'm sure, a lot of discussions that'll be going on with how things look. Abigail, thanks so much. Just to recap for you today's address, the Prime Minister said he is going to be wearing a mask going into Parliament today. This is important because we are also going to be getting new guidance from our country's Chief Medical Officer on wearing masks. So that might affect you, and if you choose to wear a mask or not, we will have all of that, of course, on Global News. Now, Trudeau also says the government is creating the Canada Emergency Commercial Rent Assistance Program. That will give forgivable loans to landlords, and that's so they can reduce the rent by 75% for small business tenants that have lost the majority of their revenue. Landlords have been asked to take a 25% hit, though we have heard that many are not willing to take the loss, and the government has been pressed repeatedly to give support directly to the small businesses for their renting of commercial spaces. Trudeau saying that landlords need to be part of the solution. Also, applications have opened today for the government loan program for big businesses that have been taking a financial hit amid the pandemic. And Trudeau again stressed this is bridge financing. This is not a bailout for those companies. You can find full details on globalnews.ca. We now return you to your regularly scheduled programming.
Good afternoon and bonjour à toutes et à tous. We will start with the latest numbers on COVID-19 in Canada. There are now 79,491 cases, including 5,955 deaths, and 40,342, or 51%, have now recovered. Labs across Canada have tested over 1,372,000 people for testing, and to date, with about 5% of these testing positive overall. And we're now testing an average of 28,000 or so people a day. These numbers change quickly and are updated regularly on canada.ca/coronavirus. As Canada's COVID-19 epidemic continues to slow and provinces and territories proceed with careful reopening plans, we are thinking more and more about how to proceed through the spring and summer months and what to plan for in the fall. Vigilance and patience will be our biggest virtues during this time. Until effective therapies or a vaccine is widely available, our aim must be to carefully balance the direct risks associated with the COVID-19 epidemic activity with the unintended health, social, and economic consequences. That means reopening to lessen negative consequences while maintaining core public health practices to keep COVID-19 activity to a low level. For the spring and summer months, strict adherence to the public health basics of physical distancing, hand washing, and cough etiquette must continue as the bare minimum. In addition, where COVID-19 activity is occurring, use of non-medical masks or face coverings is recommended as an added layer of protection when physical distancing is difficult to maintain. And staying home when sick is a must, always and everywhere. We will be hosting updated federal, provincial, territorial special advisory committee on COVID-19's recommendation on the non-medical masks today. If we can all maintain these measures to the best of our ability, we stand the best chance of keeping COVID-19 activity down through the spring and summer. This will give us more lead time to work on full range of preparedness activities in readiness for whatever may come this fall and winter. As well, suppressing disease activity throughout the summer will continue to buy time for research and innovation on medical therapies and vaccine development. I know this may not be the grand reopening we might have liked, but we won't get through this on hope alone. For the weeks and months ahead, we'll need to continue to prop each other up with creativity, kindness, and patience. When it comes to summer reopening, keeping our 2 meters is a must. Outside spaces are better than inside. Small bubbles of core contacts are better than big. And good hand washing is the right accessory for all venues and occasions. Thank you. Merci.
Bonjour. Comme d'habitude.
Good afternoon. As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 79,491 cases, including 5,955 deaths and 40,342, or 51%, now recovered. Labs across Canada have tested over 1,372,000 people for testing, and about 5% with about 5% testing positive overall. We are now testing an average of 28,000 people daily. These numbers change quickly and are updated regularly on canada.ca/coronavirus. As Canada's COVID-19 epidemic continues to slow and provinces and territories proceed with careful reopening plans, we are thinking more and more about how to proceed through the spring and the summer months, and what to plan for in the fall. Vigilance and patience will be our biggest virtues during this time. Until effective therapies or a vaccine is widely available, our aim must be to carefully balance the direct risks associated with COVID-19 epidemic activity with the unintended health, social, and economic consequences. That means reopening to lessen negative consequences while maintaining core public health practices to keep COVID-19 activity to a low level. For the spring and summer months, strict adherence to the public health basics of physical distancing, hand washing, and cough etiquette must continue as the bare minimum. In addition, where COVID-19 activity is occurring, use of non-medical masks or face coverings is recommended as an added layer of protection when physical distancing is difficult to maintain. And staying home, we will be publishing recommendations today. And staying home when sick is a must, always and everywhere. If we can all maintain these measures to the best of our ability, we stand the best chance of keeping COVID-19 activity down through the spring and summer. This will give us more lead time to work on a full range of preparedness activities in readiness for whatever may come this fall and winter. As well, suppressing disease activity throughout the summer will continue to buy time for research and innovation on medical therapies and vaccine development. We know this may not be the grand reopening we might have liked, but we will not get through this on hope alone. For the weeks and months ahead, we'll need to continue to prop each other up with creativity, kindness, and patience. When it comes to summer reopening, keeping our 2 meters, distance is a must. Outside spaces are better than inside, Small bubbles of core contacts are better than big, and good hand washing is the right accessory for all venues and occasions.
Thank you, doctors. We will now open the telephone line and the floor to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. Nous vous demandons de vous limiter à une question et une question de suivi. For those who wish to ask a question in the room, please make your way over to the freely standing mic. We will start on the phone as usual. Over to you, operator.
Merci. Thank you. The next question is from Lina Dib. Please go ahead. Votre ligne est ouverte.
Oui, bonjour. Dr. New,
good morning. Dr. New, could you explain the difference, please, between what you're saying now, recommending that non-medical masks be worn, and what you were saying up till now about masks? I don't quite understand the nuance. Could you please explain it? Answer. Thank you for the question. In fact, there isn't that much difference between what Dr. Tam and I have already said. We are continuing our conversations with our provincial and territorial counterparts. And with the science evolving, we're saying that it is a supplementary measure. As we've said many times, medical-grade masks must be reserved for healthcare workers. But for the general public, if we find ourselves in circumstances in which it's not possible to maintain 2 meters of distance from other people, it is an extra layer of protection. And it depends on the circumstances too, however. The epidemiology varies from one region to another. Obviously, if you are using public transportation in Montreal, that is a completely different situation from being in the Yukon. Up north. Thank you.
Okay, maybe my next one would be for you, Dr. Tam. So what exactly has changed for you now to say we recommend? Because you were saying that the mask does not protect the person that was wearing it. I am assuming that this is still the case. So what has changed for you now to go the extra step and not just say this is a good idea, this can be done. Now it is we recommend that you do this.
Mm-hmm. Yeah, so that's so the specific recommendation, if you like, as opposed to be, I think the previous language was more permissive. So I think just to rewind a little bit, the Chief Medical Officer's position from the start was that, of course, these masks protect others. So if you're wearing it, you're protecting other people against your droplets. So at the start, it was obviously someone who is sick, who's coughing or sneezing, if they're going to go out or have to go to a medical appointment, for example, they need to cover the cough and with facial covering or mask. That is for the sick person. So it's when we got more evidence about asymptomatic and pre-symptomatic individuals, and that although we don't fully understand their role in transmission, it is an added layer of protection. Even for people who don't have symptoms, to wear a mask to prevent transmission to others. And even though the evidence base hasn't changed too much, and particularly as people have generally been staying at home, and now that we're sort of reopening or restarting a lot of the activities, the Chief Medical Officers felt that they can recommend this for people who cannot maintain that 2-meter distance. And more specifically, if there's virus in your, there's been community transmission in your jurisdiction. And as Dr. New said, jurisdictions felt that they need to do that risk assessment because there's some provinces and territories that haven't had community transmission, and others who have clearly have and continue to have community transmission activities. So they will do their individual risk assessments in terms of the very specific recommendations locally. But I think that, from our perspective, it is an added layer of protection. It is for you to protect others. So if 2 people are wearing masks, I'm protecting you and you're protecting me. And so I think as more people do go out in the community, you can imagine there'll be more people on public transport or maybe more people, some of the retail stores are beginning to open, for example. And if you can't predict whether you can maintain that 2-meter distance, then it's recommended that you wear the non-medical mask or facial covering.
Merci, Doctor. Next question, operator.
Merci. Thank you. The next question is from Mike Blanchfield from the Canadian Press. Please go ahead.
Yeah, hi. I guess this is a question for Dr. Tam. We've seen radically different approaches in the provinces, 2 largest provinces, Ontario and Quebec, on reopening, especially when it comes to schooling, and we heard what Doug Ford said yesterday. How do you explain the differences in approach to reopening, easing of restrictions in these 2 highly afflicted and Canada's 2 largest provinces?
So at the federal level and working with the province territories, essentially the chief medical officers, we have provided guidance and criteria. But obviously, the provinces want to retain their own ability to adjust their approaches. As I think, even in the global context, I don't know that there's an absolute white pathway down this curve, as I've said. People have to do whatever they do cautiously and slowly, using the best information they have in their own particular contexts. And that if they were, reopening or loosening certain measures, they need to have the necessary systems to detect whether that has led to any increase in cases or clusters. So I think whatever pathway down this curve, there is no one-size-fits-all, and there is a certain element of uncertainty. But if you do it more cautiously and monitor it and adjust as needed, that is the key principle.
Thank you. Follow-up?
All right. Well, how do you square the differences anyway? I mean, they're 2 very similar provinces, similar sets of circumstances. Does it surprise you from a scientific point of view that 2 extremely different conclusions can be reached under these circumstances?
Well, I think as the local jurisdictions, one aspect which I'm not sure is particularly evident is that I think public health is also trying to take a holistic approach, not just balancing the sort of effective public health measures, but also looking at the negative consequences as well. You need to have some balance. You need to bring back certain activities and certain measures, getting people outside, for instance. The outside is less risk because we know transmission generally occurs, and particularly transmission to large numbers of people occurs indoors. And so I think all of those has to be taken into account. But in some areas, there may be a good reason why certain things are being opened, and in order to support the community in their local context as well. And there's a balance between the need to reduce the spread of disease compared to all the other needs from a health, social, and economic perspective.
Yeah, it's Dr. New. I just would add that even within any province, you can see the differences because obviously the provincial authorities know more what's happening on the ground than Dr. Tam and myself. They have the data. They know what's actually happening on the ground. And so we can see in the province of Quebec that what's happening on the island of Montreal and how they may be relaxing their measures, maybe in a slower fashion based on the epidemiology of what's happening in Montreal as compared to the rest of the province of Quebec. That's a prime example that even within a province that there needs to be a careful look at, obviously taking into account what's happening locally to make the best possible decisions based on what they know in terms of the epidemiology. Thank you.
Thank you. Upper next question.
Thank you. Merci. La prochaine question, Marie Vastel, Le Devoir. La parole est à vous.
Next question, Le Devoir.
Hi, Dr. Tim. My question is for you. I think I have an idea of the answer, but I would like to hear you explain why is your recommendation today on non-surgical masks? Why is it only a recommendation, and why are you not making it mandatory Canada-wide to wear a mask when we go outside? Is it a question of jurisdiction? Is it a question of there just wouldn't be enough masks to make it mandatory? Is it a question of rights? Can you explain why it remains only a recommendation?
Yeah, so at the national level, it remains a recommendation, and as the medical officers of health needs to look at their own particular context in terms of whether they actually have evidence of community transmission, and some areas actually don't and have actually never had community transmission. Is very different from, say, maybe, as Dr. New said, comparing Montreal and Toronto to Yukon or the PEI might actually be very different. So they need that ability to make those recommendations. Their public transportation systems might be different, for example. And so they need the ability to do that risk assessment and recommend it from their perspective. From the federal perspective, Transport Canada, of course, given that's their federal jurisdiction, did make the wearing of non-medical mask mandatory on those conveyances. So that is within the federal jurisdiction.
And Dr. You maybe I'll just add, certainly understand the interest in terms of the use of non-medical masks, by the general public, but one of the issues we're also obviously with our counterparts in the provinces and territories looking at closely is that the unintended consequences, where if you people think that by wearing a mask in public, they don't need to follow all of the other important public health measures that we've been underlining so many times in terms of guarding, the distance, the physical distancing of 2 meters, etc. So that's one of the things I think we still need to underline, that this is, quote, a supplementary measure that people can use to protect themselves when it's difficult to maintain that physical distancing of 2 meters, but it certainly does not replace all of the other good measures such as hand washing, etc. Thank you.
Thanks. And as a follow-up, sorry, there's an echo. As a follow-up, Dr. Tam, so as you mentioned previously, it was already suggested to wear a non-medical mask when we go outside. Now it's recommended, but in places like Quebec, for example, it has been recommended, strongly recommended, for a week already, and we see that people are not necessarily wearing it outside at the grocery store or in other locations where they can't social distance. So what exactly can you do as public health officials to ensure that something actually changes on the ground? Your language is changing, but people aren't wearing it more.
I can't speak to the very local jurisdiction, and they will adjust their approach as needed. But I think from certain public opinion research, etc., Canadians are wearing more masks, and they are more. The social cultural shift is beginning to occur. So part of what public health is doing is, the concept is one, I think, of reciprocal protection. So I think for Canadians, thinking of it as I'm protecting you and you're protecting me is a very key concept. We have to gain the trust of the Canadian public and get their buy-in to do all of this. Mandating is one measure, which some jurisdictions might take if they have to. But for the most part, I do think that the shift is occurring in the population as well, which I think is great.
Thank you, Doctor. We'll now turn to the room. First question.
Yeah, hi, Dr. Tam. It's Ryan Templeton with the National Post. The Pan-Canadian Public Health Care Network, which you're chair of, wrote a report in 2016 called A Blueprint for a Federated System of Public Health Surveillance. It recommended that provinces and the feds work closer together. It said there were gaps in how they share data. It said there were differences in how they collect data. I'm wondering sort of what progress has been made on implementing that report's recommendations to a more aligned system between the provinces and the federal government.
Yes, so I think data is extremely important, obviously, to any outbreak, and pandemic is to this scale. From a regular outbreak perspective, we have some very well-run mechanisms. So foodborne outbreaks being a very key concept of this is that we react very fast. Information is shared, but something of this scale in the respiratory domain, there's obviously some gaps, particularly reporting to the national level, that we do have to address. Some of it is timeliness, but some of the fields cannot be completed by the jurisdictions at the moment when we look at the completion rates. So we are actively trying very hard to figure out, well, what is needed? Is it more support at different levels? Can the system be made more efficient? Because efficiency in the system helps our frontline public health workers as well, who are very busy doing certain things, that there may be system efficiencies. Of course, the data comes from many different areas. It's the complexity of the Canadian landscape of data, I think. Some data has to come from hospitals. It has to come from labs. It has to come from local public health units. And so, but I think it is absolutely recognized, and also at the First Minister's level, that this is absolutely another chance for us to improve on what we're doing. But I think capitalizing on the sort of crisis that we have, we need to give it another good go for the next piece.
Thank you. Follow up?
Yeah, I'm wondering, what are sort of the barriers in bringing this data together? Is it jurisdictional? Is it that provinces don't want to ease up on their control over healthcare? And also, do you think not having shared data has hindered our ability to respond to this pandemic?
So it is a federated system, and the public health system is a local level up system. And we collaborate to get data. So that's always been the construct, is one of a collaborative approach. And so the most important thing, of course, is at the local level, they have the data that they need to actually respond to the identification of cases and the follow-up of contacts, which we all know is very important. That's the key. So then is the reporting then from the local jurisdiction to the provincial level. That has to be that is under the jurisdiction of the province and territories. From the province to the federal level, because we at the federal level don't do the day-to-day case management, that the data is needed, and the data is useful to the local jurisdictions, and they have been actioning. They have been providing advice, public health advice, based on the local level information. But it is important to get the national picture and to be able to provide that to policymakers as well. So I think we have the basic information, but I think what people needed and is asking for now is more what we call disaggregation, more in-depth analysis. We have things like age or sex, but there is a need to have First Nations, Inuit, Métis data, as well as race or ethnicity-based data as well. So those are the kind of things that we need to work on, because if you're fine-tuning your policies to support vulnerable populations, that's important. We do know, of course, we have data, for example, to provide measures or policies or programs to those most at risk, which is the seniors and the people with underlying medical conditions, et cetera. So those the kind of data is available and is driving the response right now, as you can see in the different jurisdictions in long-term care. But I think it is important to take that next stage so that we have a more in-depth analysis to further support particularly vulnerable populations.
Thank you. Next question, CTV.
Hi, doctors. Molly Thomas, CTV National News. Dr. Tam, I understand, more evidence of asymptomatic symptoms has influenced the mask recommendation, but did we drop the ball here? I mean, I think of smaller countries, the Czech Republic, Vietnam, even Venezuela have had mandatory masks in place for quite some time. Do you regret this decision, and could we have prevented the spread here if it was a different decision?
Well, I think the decision was taken to essentially ask people to stay at home, and the quarantine periods, the isolation of cases and quarantining of contact has been the mainstay of the recommendation. So we have effectively stopped, and the and decelerated that epidemic wave. So that actually has been effective. So when I say the tried and true public health measures, those are the identification of cases, contacts, isolation, quarantine, hand washing, physical distancing has worked. But so this is an added layer on top of that. And I do think that it is important as we begin to reopen. Now, people no longer staying at home. More people will be going outside. Public transit may be more crowded as a result. This will help us reopen and add another layer to that how do you go out safely message, I think. But the message to Canadians must remain all of those previous measures with this as an added layer of protection. And so then we will still have to collect some information. The kind of data to show the efficacy of the non-medical mask on top of everything else might actually be quite difficult to discern because multiple things are happening. But it would be very interesting still to try and look in the Canadian context what this has produced as people adopt this measure more widely.
So no regrets?
We need to flexibly, change our measures as we get more information. But as I've just said, it's always been, if you were infectious, that was at the beginning when we thought that the majority had symptoms, you do put a face covering on to prevent transmission. If you're even at home looking after a sick person, there's distancing, but the mask. So I think adding on this layer as we learn more was the appropriate thing to do. And I think we need to focus on the here and now, the whole hindsight thing. People can review, but maybe on all future respiratory outbreaks, this will be the actual norm to do. And so I think we need to sort of look forwards to what might be the approach in Canada going forwards.
About testing. So you said on average we're testing about 28,000 people a day. A week and a half ago I talked to you, I think it was 26,000 on average. So we're like a slow crawl up to that goal of 60,000. What is the holdup here?
So 60,000 is the capacity that is already there for public health labs. So your question is, why are we only doing, 28 or maybe higher? Some days it is higher. This is a bit of an average. This is something that at the highest levels of governments, people are seized with. A lot of this, in talking to the chief medical officer, for example, in British Columbia, they just said that their level of infection has really come down. There's no one with much in the way of respiratory illness. They will, of course, widen, everybody is widening their community testing to include even mild symptoms. And sometimes people are not actually showing up. And so it depends, I think, on the access, the uptake of the testing on the ground, not necessarily because they don't have the capacity, but also because of what the local medical officers feel to be in line with where they are in the epidemic. But having said that, we looking at absolutely how do we appropriately increase testing. For example, you've seen in certain provinces, they're looking at the vulnerable settings, long-term care, where they are looking at testing people in that setting, whether they're symptomatic or not, and the people who work there. So there's also systematic pilots or surveillance being done in different jurisdictions, and we're going to share that information across the country to see if people can learn from each other as to what's the appropriate area for increasing testing. So all that is at play. But the key is that you need to have a sensitive enough system to detect any resurgence of cases and then clamp down on the contact. So that is the fundamental principle.
Thank you. Next question, Toronto Star.
Dr. Tam, hi, Tonda McCharles with the Star. Well, that leads to what I was going to ask you about, but so specifically, since you've talked so much today on so many topics about the need to respect jurisdictions, I'm curious, what exactly are the elements that the federal level has proposed as a national framework on testing and contact tracing that the Prime Minister said was tabled last week to provinces?
So I think all provinces and territories know that some of the three fundamental aspects. So the criteria and the indicators are sort of laid down in the recommendations or the guidance of the Special Advisory Committee, which is the Public Health Foundation, for which testing, contact tracing, and then isolation and quarantine is the fundamental public health underpinnings or principle for this next phase. So everybody knows that that is absolutely critical. Everybody knows that we have to increase capacity to detect any resurgence and build the capacity towards any potential increase if we're to see that in the fall. We hope that we can sort of clamp down on any sparks and introductions. So the suppression of any sparks is really key. I think the federal government's key role is, I think the Prime Minister has offered resources, support to the provinces as needed to ramp up their capacity. We are supporting, of course, supplies, swabs, reagents, if there's a need for any other further support as well. And, committed to, looking at what else the provinces need. We provide guidance, of course, and these are updated as appropriate. So to look at what population needs to be tested over time as well.
Actually, actual national framework on testing and contact tracing proposed. Then is it overstating the case to say that you've proposed a national framework on how testing and contact tracing should go forward? You've just referred to guidelines and criteria that you came up with weeks ago. So has there something new been put on the table or no?
So I think that speaks to a higher level commitment that is a wider strategy. I think that is not just, of course, the technical guidance, but looking at supplies and other resources and support that would be required. But fundamentally, we've always had a strategy for laboratory testing, which is founded on public health guidance. And that changes over time. So at the beginning, it was targeted more at travelers because of that's where the epidemiology is at. At the peak of the epidemic, it is focused, and people are asked to stay at home and if they have mild symptoms. And so at that stage, the testing approach, the strategy is focused on the sickest people and areas of outbreaks like long-term care and healthcare workers. As we begin to get this first wave under control and into this recovery, reopening phase, is about widening then that testing, for example, to people with mild symptoms who would never sort of in the previous phase was necessarily tested. Now we're expanding the testing to particularly symptomatic but with mild symptoms, as well as a very low threshold for testing everybody under certain high-risk settings, whether it be long-term care, acute care, correctional services, shelters, Indigenous populations that are at higher risk of the severe impacts. And so this is fundamental to the strategy. And also then, how do we widen surveillance and having surveillance systems which are built upon respiratory illness surveillance, but maybe there are other surveillance approaches that we can take. We call those pilots or surveillance activities, which can take into account, for example, the testing of asymptomatic people. So that is the actual approach which varies and will be adapted. So I think is an adaptive testing strategy, which is now moving into the next phase. At the same time as doing that, ramping up our capacity in every single channel that we can. So the other aspect to the strategy is that right now, there are three modalities we're looking at. One, the existing ramping up of the laboratory-based PCR testing. That is the key to testing whether you have the infection now. Widening that from the lab-based to point of care. So that's part of the strategy, getting point of care tests, getting supplies, particularly to cover the rural and more remote areas. That is still a work in progress. We're getting Gene Expert and Expert Express SARS-CoV-2 test kits now. You've seen the La Loche, you've seen Nunavut and others having these supplies. So point of care, particularly to coverage those areas, very important. Thirdly, you've heard the immunity task force. Serology will become the third component of the testing strategy. The primary key aspect of that, as you've probably already heard, is to conduct those sero surveys, which we believe will be conducted pretty fast, to uncover how much of the population, what's the prevalence, and how much of the population has been infected. That is important for policy decisions, not just now, but as we get a vaccine, for example, in the future, to know what the population immunity is and where we might be going with vaccination strategies. Those same prevalence studies, together with actual research on the immunology of the response of the body, the antibody response, in other aspects of immune response, will then help the further use of serology for an individual diagnostic basis. Right now, that is not ready for prime time. So that, to me, lays out the actual strategy and the modalities of the testing approaches. But fortunately, there's a lot of research right now, and there will be other tests that could potentially be available, at which point those will also be scoped into the strategy itself.
Thank you, Doctor. We'll go back to the phone. Operator.
Thank you. Merci. La prochaine question, Micheline Laflamme de Radio-Canada. La parole est à vous.
Next question, Radio-Canada. Please go ahead. I would like to know what the determining factor was leading to this recommendation that you're now issuing. Was it in consultation with all of your provincial and territorial counterparts? Were you waiting for a consensus opinion? What was it that led to this new recommendation? Answer. Thank you for the question. This is Dr. New. Well, it's a very current issue. Dr. Tam and I have ongoing conversations with our counterparts. Science has changed as well. The science has changed as well. At the beginning of the pandemic here in Canada, our recommendation was based on what we saw on the ground. That most of the transmission came from symptomatic people. But given the experience that we've seen across the world and here in Canada too, we learned since then that it is also possible for asymptomatic people to transmit the virus. Now, we know, and we don't know exactly what the percentage is, but we do think that most of the transmission occurs from symptomatic people. But given the current evidence, we, as Dr. Tam said earlier, we discussed it with all of the chief medical officers of the provinces and territories and said and came up with more permissive recommendations. But now, given jurisdictional issues, some provinces and territories are beginning to open up and come up with their own public health recommendations according to their context. We can say, well, now that not everyone has to stay home all the time, especially with nicer weather, people can go outside. But given that, there may be a new risk if people take public transportation, for example, or in certain other environments, it may be difficult to maintain 2 meters of physical distancing. And so those circumstances also changed with the coming warmer weather and the coming summer months, that the chief medical officers of the provinces and territories and Dr. Tam and myself said, well, this is more a recommendation. But of course, it depends on where you are in the country. As we've already stated, yes, what's going on in Montreal is completely different from what is going on in the Northern Territories. Which is why we changed the recommendation to some extent, depending on the circumstances. Does that help? Answer, yes, thank you. Question. Now, we know that you greatly emphasize this, but could this also give people a false sense of security? We saw on the weekend that more people were wearing masks, but were no longer respecting the physical distancing rules. Will public health agencies need to keep an eye on that to ensure that initial health measures are still being observed? People do not seem to be standing 2 meters apart, generally speaking. Answer. Well, that is of concern, but we and all of our counterparts are saying that, yes, if we are now recommending the use of non-medical masks, we still don't want the general public to think that, okay, then we can stop performing the other measures, the other public health measures, which are still highly recommended and are clearly effective. Social distancing of 2 meters, frequent hand washing. We must absolutely continue to practice those good public health measures. And this is just a supplementary measure, as we've said. Thank you, Dr. Tam.
Merci, thank you. The next question is from Althea Raj from the HuffPost Canada. Please go ahead. Your line is now open.
Thank you very much. Dr. Tam, my question is about proper mask etiquette. A few weeks ago, you were mentioning how important this was, but could you kindly walk the public through how to take off your mask properly? When I go from one store to another store, can I reuse my mask? Should I be putting on a new mask? Should I be carrying a little baggie in which to put my contaminated masks? What is proper mask etiquette?
So I think I would also point people to the website. I'm trying to think, canada.ca/coronavirus, because it'll be easier, I think, for people to get the different steps from the information as well. And so, yes, so I think one key, some of the recommendations pertain to materials. In fact, there's actually quite interesting studies now, now that there's more interest in wearing a non-medical mask, but the most basic materials are like cotton, but you have to have different layers so that when you hold it up to the light, the light doesn't shine through. So there's different tips as to what kind of materials to use. But I think the other thing is also fit, so that you can't have, gaping air coming through the side of your mask, for example. So making sure that it fits your face and etc. So hand washing, as we all know, is the key to everything, and frequent hand washing. So before you put a mask, when you're removing a mask, is actually very important as well. And try not to touch the external side of your mask, for instance, but certainly washing your hands. You can, I think carrying a Ziploc bag or something is actually important, because then you can put your mask in it when you're not wearing it. Now, that is, you're not letting other people touch your mask. I think that's very important. And that you are using it yourself, and using the hand hygiene. And of course, having washable materials that you can then wash at home, I think is important. But yeah, don't use. Well, you definitely don't let other people touch your mask. Your whole concept is protecting other people. If it's your own secretions, it's your own secretions. Keep it to yourself, and wash your hands really well, I think.
Thank you, Doctor. Dr. New, maybe I just add to that sort of on the practical side. So if you mentioned that you're going from store to store, the most important thing, if you're adjusting elastics, is don't touch your face, right? You can put your elastics here and put your mask on. And of course, I think many stores now or many places in public have obviously the hand sanitizers, etc. So if you are then adjusting your mask and so on, as often as you can, as Dr. Tam says, wash your hands or take advantage of the hand sanitizers as well. But the most important thing in terms of the mask that we've seen is that it sometimes gives people a false sense of assurance, and then they unknowingly or whatever, by fiddling with the mask, they end up touching their face. And as we know, the most important parts to try and protect and not touch, because that's how the virus enters, is actually your eyes, your nose, and your mouth.
Yeah, no, that's a really good point. I think the key is, yes, we have a lot of, public health always has a lot of, key messages in terms of, because we're all a bit worried that with this added layer of protection, people forget other things. But I'm actually pretty confident in Canadians. I think people can learn and adapt. And this is one aspect that I think we will all learn as we go forwards together in the next days and months.
Thank you, Althea. Follow up?
Thanks. So we've had a few questions from the public about the wearing of masks, and I'm wondering, I know you said obviously circumstances are different across the country, but for people in urban centers where there has been community spread, would you like to see employees in stores wear masks? Should joggers wear masks when they hit crowded paths? If you have folks over in your backyard, should these people be wearing masks? Thanks.
So I'm sure there's a lot of different situations and permutations, and local medical officers are no doubt answering very similar questions. As people restart certain businesses, in every jurisdiction, there's instructions in terms of providing a plan for your reopening, which includes, in many sort of situation, what we call the hierarchy of controls, and in terms of protecting staff, but also customers. And it's not just mask, again, is an added layer of protection, because you actually have to look at physical barriers like plexiglass. You have to look at schedules. You have to look at how you're going to reduce the numbers of people, perhaps whether it's in your office setting or the store, in order to get that physical distancing. So that physical distancing still remains a fundamental aspect of this. So then you're looking at your specific circumstances in terms of your workplace, what that workplace is, who you're serving, and as to whether the non-medical mask is appropriate. But obviously, again, the fundamental principle being, if you're in a crowded space, you can't maintain that 2-meter distance. I think the outdoors is definitely less of a risk than indoors. So I think for people jogging, if you're on the outdoors and you just sort of passing someone very quickly, that is a much lower risk than if you were inside, for sure.
Thank you. Dernière question au téléphone, opérateur.
Last question on the phone.
La prochaine question est de Louis-Samuel Perron de La Presse. La parole est à vous.
Next question, La Presse.
Oui, bonjour.
Question.
Si je comprends bien, le port du masque était
If I've correctly understood, wearing a mask was simply a suggestion before. So I'm wondering why you're not making it mandatory to wear masks.
Merci pour la question. C'est Dr. New.
Answer. Thank you for the question. This is Dr. New. Using non-medical masks is really something that I find fascinating to observe. It's a shift, a cultural shift in our Western countries. It was already a fairly widespread and normal habit for residents in Asian countries, and people who were sick always wore a mask if going out in public.
But it's about being comfortable and more comfortable. And as Dr. Tam has said, it seems to be more widely accepted within the Canadian population now here too, and we are seeing more and more people wearing masks here. So we need to educate the population as to the benefits of wearing non-medical masks. It's not so much to protect yourself from others, but should be seen as a sign of respect, perhaps, because you're protecting others. In case you have, you're protecting them from your own droplets, just in case you're asymptomatically ill. Now, in provinces and territories, however, it's up to them to mandate the wearing of masks. And the epidemiology is quite different from one area to another. So the situation in Montreal, as I've said, downtown Montreal is completely different from what's going on up north in Nunavut, for example. So we cannot have a single policy across the whole country mandating the use of masks. We really have to see what's going on the ground in each province and territory. Following this pandemic, perhaps with future outbreaks of respiratory illnesses, it will become the norm for people to wear masks if they leave the house. And it will just become part of our normal habits. Thank you. Follow-up question? Do you have more concrete examples to tell people when they should be wearing masks when they go outside? Answer. Thank you for the question. It's difficult to provide people with all possible examples, but I could provide you with a few. Of course, I keep coming back to Montreal because my family's in Montreal, and so it's top of mind. But it is an additional measure that one can use outside the house when it's not possible to maintain 2 meters of physical distancing from others. Public transportation is a good example of that. We don't currently know what's happening, but more and more people will be leaving their homes now. And if one is on a bus, as you can imagine, it's going to be much more difficult to maintain a physical distance of 2 meters from other people on the bus. So I think that Montreal's public health authorities and in Quebec and across Quebec have recommended that people wear masks on public transportation. Stores are another good example. For example, let's say you're in a large store with a great deal of space and all kinds of measures have been taken to keep customers socially distant. It may not be as necessary, but still is something to consider doing. But if you compare that with some people who have gone into a small corner store, well, the same principle applies. If it's not possible to maintain 2 meters distance with people around you, then it's a supplementary protective measure. I hope that those examples are good for you. Thank you very much.
Can I just add that again, patience and compassion is needed in even looking at mask use. I just want to sort of remind people that for people with disabilities, we need to make sure that we have some understanding as to their needs, including the wearing of non-medical masks, and particularly for mass and the hearing impaired. They and their communication partner, for example, there needs to be consideration for maybe having a clear face shield or other means so that those who are hearing impaired can continue to be sort of considered in all of this. So why I think it's important for Canadians to sort of think of this measure as being you protecting others and others protecting you is to generate that concept of solidarity, really. And so I think please be very aware of those with different types of cognitive, intellectual disabilities, those who are hearing impaired, and others. So just be patient and don't assume that someone who isn't wearing a mask or is wearing something different doesn't have an actual reason for it. Thank you.
CBC.
Julie Van Dusen, CBC. Dr. Tam, I'm wondering if you could blame Canadians for being confused. It wasn't so long ago that you said, don't bother wearing a mask because it might protect others, but it wouldn't do much for you. Now you're saying, if you wear one, you protect me. If I wear one, I protect you. Can you explain the evolution?
So it's always been sort of protecting others. So non-medical masks, medical masks aside, that's to prevent with eyes covering on all PPE is to prevent you getting infected by others, particularly healthcare workers. Wearing non-medical masks has always been a protecting others from if you're infected. So it's always you protecting others. And so at the beginning, it was about people who have symptoms, who should wear a mask. If you say in the home setting, on an airplane, if you found someone who is sick or going, you have to go to the clinic or something, then the sick person should wear the mask. Now here, you're considering, if you think about it, if you're in a community where there is actual transmission of the virus, just consider everybody as potentially being that sick patient, because you can't actually tell, right? So that's the change. Is asymptomatic people could potentially be infected or potentially transmit. Again, you're using that covering to protect others. So that concept is the same all the way through. But at this particular time, when people have used the tried and true measure of staying at home and physical distancing, beginning to go outside and beginning to get to those more crowded places where you can't control that 2-meter distance, wearing the non-medical mask or facial covering, again, protects others from you if you happen to be infected. And it's a reciprocal thing. So if everybody is wearing a mask, you're protecting others. And by the other way around, they're protecting you as well.
So could you just explain what exactly is new today about what you're talking about? Because in the past week or so, 2 weeks, you've said, wear a cloth mask if you go to a crowded place like a grocery store if you can't keep physical distancing. Now you're saying the same thing today, except you're recommending it. What is different, especially if it's voluntary, even in hot zones? Like, what is the news today? Could you please explain that very clearly?
Well, there's no actual real news. And the key is that we're about to post the actual wording, which I've been actually communicating for some time. And it is based on a consensus with the other chief medical officers of health, so that it's to provide further clarification, I think, across the country. But there is flexibility, as I said, for the local medical officers, depending on their situation and risk assessment, to recommend that to their local population, and you have to listen to your local public health.
Big difference is you're putting it on your website. Is that the news? What you've been saying for like the last 10 days or so?
Just to reinforce that, yes.
Okay.
Thank you.
Thank you, Julie. Last question, Mike.
Hi, hello. Dr. Tam, you're testing 28,000 a day. The lab capacity is 60,000. So basically, we're not testing 60,000 a day because we're going to get false positives, we're going to get false negatives. It's not helpful. But say there was 30 clusters that just exploded out there. Do we have the capacity today to do 60,000 lab tests a day if we need to?
Yes, and it's not us or the federal government. This is the public health system in Canada. So that is their capacity. So they can ramp up if there's a cluster that needed to be tested. Of course, this capacity is distributed across the country. If there is a particular area of the country where, let's say you're in northern Saskatchewan, you get an outbreak, the key is that we will support whichever jurisdiction will surge if they need that too. So that's really important, because the capacity is easier to reach if you were closer to the bigger centers. We are going to be sort of supporting the more remote areas. But even the point of care test is a machine. You have to be trained to how to use that. But they can be deployed, they can be reinforced, so that what you brought up is a really important point. If you spot a case in the context, if there's a cluster, you got to move in really fast. And the laboratory capacity is designed to be able to do that.
Okay, and we have all the supplies and stuff ready to go in case this happens tomorrow or a month from now.
Yeah, so as of this moment, I know that there's enough supplies. But as you know, every day, all those situations could change, and we work every single day to make sure that we have what we need. So that is the capacity that we have. But that doesn't mean that tomorrow I may not tell you that there's a potential issue or something. But the good news is that there's more and more capacity, and there's more and more domestic capacity.
Thank you. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Merci.
This brings today's press conference to an end.